You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. My first guest is an expert on the topic. He is a board-certified oral and maxillofacial surgeon. Dr. Musser, welcome to the program.
Thank you.
All right, now before we get into today's topic, we've had you on the show before. Tell us, for those who don't know you, about your center.
Well, our center is one of the largest facilities in Florida. I don't know if it's the largest.
I mean, 10,000 square feet, is that right?
That's right.
That's big.
We have all the technology available to do advanced dental implant treatment.
Okay.
And we have kind of a fun facility because our reception room is a full theater.
Yeah, I've got to see that one of these days when I'm in Florida. I mean, you walk in and there's
Yes.
a theater.
Yes. Immediately to your left when you walk in, there's a full theater with 40 theater seats. So most people do a double take when they come in.
Is that right?
So that serves as our reception room during the day. But we also use it for educational seminars for doctors.
You teach other doctors, other dentists
yes.
about dental implants?
Yes.
Okay, good.
Yes. So we have a study club. We have 30 of the local dentists that meet with us once a month, and we fly in speakers from all over the world.
What are the and you know, on today's program, I thought, you know, okay, let's ask him the frequently asked questions that they all want to know. So at these workshops or seminars that you put on about dental implants, what are the top 3 questions that come up?
Well, the number one question that people have is, am I a candidate? Can I have dental implants? And the answer to that is almost always yes.
Okay.
You can. Even if you've been told that your gum and your bone are not adequate for dental implants, with the new techniques of angled abutments, we can almost always do treatment that makes you able to have teeth that are functional and beautiful in your mouth. There are some rare medical conditions.
Like cancer, things like that?
Cancer, bone cancer, and some people that are on chemotherapy. But those people are really not coming into my office and inquiring about dental implants.
Okay, so the people, and by the way, what is that evaluation like? I mean, how does somebody find out if they are candidates? How fast is that?
Well, it's really very quick. I like to spend about an hour talking to people about what has happened to them before and what we can do to reach their goals.
Okay.
Now, one of the diagnostic tools that we have available right in our facility is a cone beam CAT scan. That's not like the big donut machine that you see on television. This is a specialized CAT scan for dental procedures. It's very accurate, so we can make our measurements on the CAT scan, and we can also create 3D images. So we can actually make a 3D model of the patient's bone structure and place the implants ahead of time.
Okay, so at this 2-week seminar, are there people, they go to the seminar, make an appointment right away, it all starts with the image?
Yes.
Is that right?
Yes.
Okay.
That's the first step. We have to have some diagnostic tools, and the CAT scan really gives us almost everything that we need for a full diagnosis. Okay. There are some other things that we get into step by step, making molds of the teeth, things like that that are in preparation for the surgery. And what I really wanted to talk about today is teeth in a day, which I think
teeth in a day.
That is just amazing. It sounds too good to be true.
It does.
And people ask, how do you do that? Well,
so a denture wearer can get teeth in a day?
Yes, actually.
Tell me what that means. Define that in your with your definition.
Well, teeth in a day means that you come in the morning and you leave in the afternoon with teeth that are actually fixed in your mouth.
Okay.
You have a new smile. If you were unhappy with the way your teeth looked when you came in at 8 o'clock, you're going to be totally changed when you leave at 4.
Is that right? So in an ideal situation, okay, they're somewhat healthy or healthy, they get the image, and then on a separate day.
No, we do all this.
Oh, really? Same day?
We can do all this in one day. And some of our patients come from a long distance. Some of them actually fly in. We've had patients from London. You know, this is the internet era, so people.
I actually didn't know that. I was afraid to ask you that question.
Well,
so teeth in a day really is teeth in a day. They go in, they get the image.
Teeth in a day.
And then they go in at 10 a.m., get an image. By 4 o'clock, they're walking out with a full set of fixed teeth?
Yes, they're fixed, but that's not always the case.
Right.
We do need to make molds of what their existing dental condition is, and then we have our laboratory technicians that actually make the teeth.
Okay.
And there's a decision-making process. We decide what color the teeth are going to be, what shape are they going to be. Sometimes I'll have patients bring in older photographs, and we can almost always match the shape and color of their teeth when they were younger. So that's exciting for the patients, and it's exciting for us too.
So they actually get the teeth placed, the surgery done that day, and walk out with teeth the same day?
Yes. Now,
Okay.
there are some diagnostic procedures that need to be done ahead of time. One of them is the CAT scan, and we do that at the time of consultation. We also have to make molds of their existing dental condition, and we have to give enough time for our laboratory technician to create the new teeth. But on the day that the patient comes in for treatment, they have their surgery done, and that afternoon we put in the teeth that were created ahead of time.
And these are cosmetic looking teeth. I mean, it looks good.
They look beautiful.
It's like it's spot dentures.
No.
I think I told you that.
These are not going to look like dentures. They're going to look more like natural teeth.
Okay.
And as I mentioned, we can even match the shape and size of a patient's teeth from old photographs.
Do most people want to be put out completely? Are they sedated? Or what?
Well, we have a full range of anesthesia, and depending on your medical conditions, we can sedate or use general anesthesia. Occasionally we'll have an anesthesiologist or a nurse anesthetist come in and do anesthesia for us for a long procedure. But our facility is really an outpatient surgical center. We have a complete Category 1 operating room, just like a hospital or outpatient surgical center would have.
Okay, now, so I understand this correctly, because, you know, our show is about options, letting people what they need to know. 10,000 square foot facility.
Yes.
People don't like going to the dentist. Is that correct still?
That's right.
But they like going to you, supposedly, right? That's what you say. But the way it's normally done, and we've done our research, and correct me if I'm wrong, they go to one dentist that is the surgeon, then they go to another dentist that puts the teeth on, which separate facility oftentimes, and then another place to get the imaging. So 3 different trips to 3 different centers, and then the communication has to be between at least the 2 dentists that potentially don't work under the same roof. Is that correct? Is that how it's normally done?
That's one of the ways that it's done. We built this facility in 2002 so that we could make it convenient for our patients to have treatment quickly.
Okay.
And we've been able to do that. We have the technology to do all the diagnostic studies right in our facility. We're affiliated with a number of general dentists that come and help us treat the patient by making teeth for the patient. But all of that can be done in our facility.
So back to frequently asked questions. Okay, so they want to know about pain, they want to know if they're candidates. What else?
How much does it cost?
Okay.
Everybody wants to
Good
know
question.
about that. And some people like to jump right to the bottom line. But we really can't do that without our diagnostic studies.
All right.
So,
But it's not like you're filling in a tooth for everyone that's missing, right?
most people think that we actually screw a tooth into the bone, and we have to do that 26 times or 28 times to get a full mouthful of teeth. But that is definitely not the way it works. As few as 4 dental implants on top and 4 on the bottom are enough to put in a bridge that allows for a full set of lower teeth and a bridge that allows for a full set of upper teeth.
Okay.
That's just 8 to 10 implants.
So 4 implants, and they get, I guess it looks like a denture from the top, but it fastens on?
It
or
really
it's
doesn't look like a denture. It doesn't cover the roof of the mouth, doesn't have long projections that go underneath the tongue or right on the gum tissue at all. It's just the teeth with a small amount of gum-colored material. And the teeth are actually attached with screws that go into the top of the implants.
So just 4 implants, like for example on the bottom?
Almost always 4, unless you're a 280-pound man, then we might go to 6.
Okay.
But in the upper jaw, most people have enough bone that 4 implants is enough. Now, some people who have been wearing dentures for a long time have severe atrophy of the jaw, or melting away. That's what happens when you lose your teeth. Your bone starts to melt away. So we have some special techniques and some special implants that helps us to allow this patient to have treatment. We angle implants and bypass the sinus, and we can put implants into very atrophic bone and be successful because of our knowledge of anatomy and where to put the implants.
Now, you know, we've talked and you know, we've joked about the fact that maybe because I have all my teeth, I don't realize what an important topic this is. But you say you're changing people's lives. That means you give them their teeth back, and you see life changes. Elaborate on that.
Well, Randy, in my seminar, I see people that come in and they're asking questions, but I really know, since I've been doing the seminars for 20 years, I know what they're thinking. Am I going to look better? And, you know, I really feel pretty crummy. I don't feel like I did or like I used to. I'd really like to feel better. And I know if I could smile, then I'd feel better. And they may not be able to express that, but I know that that is inside of all human beings.
Okay.
So that smile comes from your heart. And if we can give you the ability to smile again, you're going to feel a lot better.